Welcome back to the Lipoedema Podcast. We're your host, Shell.
And Tiana. Joining with us today is Nova because she is not well and you got to do what you got to do. We're doing a little episode smack today.
We are. So last weekend, Tiana had the privilege of going down to the conference in Canberra. I unfortunately couldn't make it, but I did jump on for a couple of the virtually I jumped on and was able to see a couple of the sessions that I wanted to see. But we thought we'd just chat through your key takeaways today. And then we might over time, because we get 3 months, so 90 days to go back. And because when you're at a conference, it can be really tricky to take in everything that's going on. And then you write notes and you're like, what did that mean?
I wrote so many notes. For those of you watching and enjoying the lovely sights of Nova pulling my hair, I wrote pages and pages and pages of notes. And can I make sense of them? Not really. But I do have, a few really key takeaways.
Yeah, the gold nuggets that have cemented themselves in your memory. So let's start going through what they were for you.
Yeah, I mean, first of all, privilege is a great term because I did feel super privileged to be there. But your absence was palpable, not just to me, but to everybody else. And every time somebody mentioned you, like when the board thanked all the board members, which you are included, I got a little bit teary because I was like, she's not here. But when I was reflecting on it, we wouldn't have been able to hang out anyway because the board members were running around like mad chooks the whole time. Gosh, they work hard. They work so hard. And it was such a credit to all of you as board members and advisory board members because that was the most incredible conference.
Oh, it's so good. And the thing is, usually it's 2 years apart, but this one was bang straight after so that we're not having the Lipoedema Australia conference at the same year as the ALA, the Australian Lymphology Association. So we've alternated now so that their main conference is 1 year and ours is the next. So that's why it was straight after.
Yeah.
So now we have 2 years to get ready for 2027.
Thank goodness we have 2 years because I think it's going to take me 2 years to decipher all of my notes.
They're hieroglyphics, people.
I have the most terrible handwriting. As we alluded to, there were a couple, probably like 4 or 5 really key takeaways that I got from the whole week. And I guess one of the most important ones was the power of having a platform like that for the people who live with lipedema. As somebody who, yes, we have a podcast, we have that in from a advocacy perspective, but just as someone with that lived experience, to connect with other women with that lived experience just warmed my heart and made me feel seen. And I just found that to be so beneficial. And I don't think I'm alone in that thinking. It was such a nice way to connect. And the specialists that came, the surgeons that came, the experts that came were just so gracious in welcoming us in and talking to us as the people that really experience this condition and might get to experience their services. So that was also nice to have that cross-pollination between experts and warriors.
Yeah. And it's just that community feel. When we all get together, it's like the one place you don't have to explain, oh, I need to have a seat now because my legs are a bit sore, or, oh, I can't eat that, or whatever it is at this moment in time for you.
Yes.
You don't have to explain it because everybody gets it. And
So
I think
true.
there's something like, we speak of the cognitive load of this disease or condition, but you can let go of some of that when you're around your girls that get you.
Speaking of the food, I hear a little birdie tell me that Megan Pfeffer, clinical nutritionist, oversight of the food. Well, can I tell you, she did an incredible job because the food was delicious. Well done, Megan. If you're listening, well done for you. In fact, we're having Megan on the podcast in a week or so, and we can't wait. So watch out for that episode. We're going to be talking about histamines. Anyway, back on task, Tiana. So, key takeaways. So, Gabrielle Faber, Germany, she was one of our keynote speakers. And it was really interesting to hear her talk about how there is a lack of consensus for lipedema and its presentation and its diagnosis. Even like there's two international bodies in lipedema and they don't agree really on like what lipedema is, which I find so interesting. So I can imagine how in terms of progressing like knowledge of this condition forward, like that would be really difficult
Yeah, for
unless there is
sure.
a consensus.
Yeah.
So
Otherwise, you could be working against each other.
well, that's right.
Yeah.
And, as a person who experiences this condition, it's confusing for us. And then I think about our first point of call is our GP, and our GP has to know about a variety of things, like everything in the medical community. But if our experts can't agree, how's it supposed to drill down to our primary care doctors?
Yeah.
And what I thought in my mind really is we need to give our primary care doctors a little bit of grace because, as I said, if the experts in the field can't agree and there's still so much unknown, we cannot expect our primary care doctors to know and talk about it with any sort of gusto, I
Yeah.
suppose. Yeah.
And also, we don't have the time with them either.
10 minutes.
Yeah, 10 minutes. Like even if they've heard of lipedema, can you imagine trying to explain it to someone in 10 minutes?
Yeah. Well, that's the elevator pitch.
Yeah, yeah, right.
Yeah,
Doctors
that's
need their elevator pitches as well.
Yeah, and that's also why the Lipedema Australia have those pamphlets to give your like clinical pamphlets, and they
Yep.
also have those diagnostic sort of tick boxes that you can do and bring into your. So those tools that Lipedema Australia have just makes it even more important to have for our primary care doctors. So
And with that being said, you can jump on the Lipoedema Australia website and you can order pamphlets, postcards, all of those things. So if you have an event coming up or you speak to your doctor and they'd like some pamphlets or, one of your allied health providers, jump on, order some pamphlets. They send them for free and do our little bit.
great idea. Yeah, great idea.
All right. So Gabrielle was one of the keynotes.
Yeah.
Chantel was the other
Yes,
keynote.
Chantel was another keynote and some great research, and in fact won one of the Lifetime Australia awards specifically for
yay!
her research, which was wonderful. And she had a couple of presentations that I saw, and then I think another one in the clinical day. And so I think I saw two of hers, and it was all around mental health, the psychological aspects of dealing with a condition. And, you really felt that. The data that she showed was really startling. The fact that, women with lipedema usually present to their doctors in a larger body and are often misdiagnosed, mistreated, and the doctor assumes that all of their symptoms are due to the fact that they are overweight. So they already come in with that stigma and they're not taken care of, and then it makes them withdraw from society, and
Mhm.
withdrawal leads to depression. And if you do go out, there's lots of anxiety there. She had all of the different kind of psychological presentations, and the fact that they seem to increase as the presentation of your lipedema gets more serious. So they become more of a problem. Your psychological experience becomes harder as you progress through the disease. I really felt there was a lot of emotion when
Yeah.
she was talking. And, that sort of led to the fact that it's super important to seek psychological support when you're dealing with a chronic condition. And also that all of our clinicians or the people that we seek health advice from need to come at it with a compassionate lens. So compassion first,
Yeah.
And as you said, with our primary care physicians that only have 10 minutes for us and want to get stuff done, compassion can be missed, but it can't be missed
Yeah.
because we are already very fragile because of our lived experience.
Yeah.
And so how do we help them balance that? Or how do we understand that in their 10-minute appointment, they're just trying to get things done. It's not that we shouldn't expect compassion from them. We need to expect compassion from everyone. But also, maybe they just of that, diagnosis, answer, because they've only got that short period of
Yeah.
time.
Yeah, they're not root cause people.
Not root cause, symptoms people.
Yeah.
Yeah.
Yeah, they're treating symptoms.
Yeah.
Yeah.
That's a great point. Pardon me. So I really enjoyed listening to both of her chats. And I did ruminate on like what compassion looks like in terms of rocking up to the emergency department with some acute presentations, but you live in a larger body and you have a chronic condition. And then what compassionate care looks like when you rock up to your GP to discuss random things. And, that's really complicated. But for those of you who feel like you are not at your optimal, like with your tolerance, with your psychology, psychological support is so important when you're dealing with a chronic illness.
Yeah,
It
for
really
sure.
is.
Yeah, speaking of GPs, so I went to my GP. So I'm on work cover, so I have to go every month to get my certificate signed off. Anyway, I went into him and I said that, I was concerned because I've put on some weight since I've been home. And he stumped me because he said, not everyone's supposed to be skinny.
Wow.
And I was like, what? And he said, I'm trying to educate people that not everyone's supposed to be a certain size, that we're supposed to have big and small and tall and short. And he said to me, just focus on getting some exercise in because you're, sitting around a lot and you're stressed out. He said, so look, next month come back. He said, and, try and lose a kilo this month. That's it. He goes, it'd be good for you to be under 100 kilos just for the pressure on your organs and all those sorts of things. He said, but that's all you should be aiming for. Oh my goodness. And he bulk bills. Go Dr. Hassan. Dr. Hassan. Yeah, so I was
refreshing,
blown away by that. So I'm like, yes.
Too right.
I know, right?
Refreshing.
Yeah.
And I think, more of our clinicians are going to liven up, I think, to those because I feel like they, especially if you talk to them about like PCOS or infertility and things like that, they're like, well, you just need to lose weight. And then you lose weight and you still have those probably like, what now, doc?
Yeah, now what?
Yeah, now what? Like, if that's not the only answer, living in a larger body is not the thing that makes all the other symptoms be the thing.
Yeah.
Anyway, that's very cool.
Yeah.
Like, thank goodness.
Yeah. And, last year I actually sent his surgery a link to that Praxa Hub Lipoedema Australia training. And he emailed me back and he said, thank you. So, when the next lot comes out, we'll be able to push it again. All right. So I did listen to Ramin when Ramin was chatting. And the thing that blew me away was when he was talking about research and he said, we'll get to a point where surgery isn't necessary.
Oh my God, that would be amazing.
And that blew me away because...
That'd be amazing.
Yeah. But I did ask a question and I don't know, he didn't respond within that time. So when I find out what he actually responded with, because I asked, was that because of early diagnosis or that our conservative management is going to be that good?
Ooh,
so what's new in conservative management that he can foresee? Because I remember last year, Tara had alluded to an injection like the GLP-1s, but that would target the lipedema gene when they know it to turn it off.
Oh my gosh, imagine. Look, I also asked Prof. Cheyenne a question in his talk because he mentioned that there is clear pathological differences between lipedema fat and normal body fat. And so my question to him was, if lipedema tissue is pathologically different to normal fat tissue, would biopsy be an adequate diagnostic tool? Apart from being invasive, why else might not this work? Yeah. I mean, could you imagine going to a doctor and then having to get a biopsy of your tissue? Like, that is very invasive. So I'm not saying it's a perfect tool, but wouldn't that be, sounded simple to me. Anyway, he responded and he said, they've actually tried that, but the trouble is that there is so much variability and heterogeneity in the characteristics of the tissue. He said, but yes, once we have identified the suitable biomarker across all patients, he would certainly use it as a diagnostic tool. So that's really interesting. If they can find some commonality in all of the lipedema tissue amongst all that variability, perhaps it could work as a diagnostic tool. I'm not going to put my hand up to be biopsied straight away. Yeah. But wouldn't that be great if there was something so concrete as a diagnostic tool, testing the actual tissue?
When we had Dr. Adrian Brooks on, he said it feels different, like out of the cannula. It's like it's white and it's sticky and oily, not like normal fats, like the yellowy fat we're used to seeing. But he said that lipedema fat was white because when he brings it out in the cannula to reuse it, like he can tell because he does a lot of
Fat transfer.
fat transfers.
Yeah, fascinating.
But even within that, he said some people's fat isn't good enough for a transfer. So even within people without lipedema, there's a variation in how your fat molecules are. So
That's really difficult.
there's too many variables.
Yes. Helen Easton is one of the, is she a board member or a
Advisory.
board? Yeah.
Yeah.
So she did a talk and, really honed in on the fact that the diagnostic presentations are so different around the world. So we don't have a consensus, a standardized way to diagnose. But she also mentioned like the name of lipedema and is it a disease? Is it a condition? Is it a, sort of, I feel like it's been called a disease. I actually call it a condition, but she was looking at the definition of disease. It doesn't quite fit that because it is, I think you have to have, where the cause. If it's a disease, you know what the cause is. So she's suggesting that we might have to change it to be a syndrome.
Like IBS.
Like IBS or PCOS. Actually know the cause, but it is a condition that, like it's real and it's ongoing. So yeah, she's suggesting that we should change it to be a syndrome. I found that to be really interesting too. Another key takeaway. And then, I really liked this talk. So Nikki Knighton, another one of the Lipedema Advisory board members, she had this incredible talk on pain, the presentation of pain. And I must admit, as I was listening to it, I found it really hard to stay in my lived experience lipedema because I have a best friend who deals with CRPS, which is a chronic pain syndrome. And she's been dealing with it for, I think, 5 years now. And it's on her face. And you can see when she flares up, you can see it every day. And I just can't imagine living in her body. And, one of the first things that Nikki said in her presentation was all pain is real. And honestly, I got so emotional. I messaged my friend and I said, I wish you were here listening to this with me because it was so validating to her experience. She spent, I think, at least a year going to doctors with the fire in her face saying that something's wrong. And because she has a history of anxiety and other presentations like that, they just said, well, it's just you're just anxious. You just need to go back to your psychologist and, use all those tools. And she was completely mismanaged for so long that it spread and became worse. They didn't nip it in the bud.
Oh, the poor thing.
Anyway, so I loved it so much that I spoke to Nikki after her presentation and told her that. And I said to her, we need to get you on the Lipoedema podcast to talk specifically about pain. Yep. Lipoedema pain can present so differently. For me, I get aches and I have pain on palpation. Okay, like painful to touch. So my legs ache, my arms ache, but also if somebody pinches me or something that really hurts or tickles me, that really hurts as well. But yes, next year we will have Nikki on and she will talk about pain.
Awesome.
I loved it.
He's so good.
Yeah,
I did. So I forgot I could go and look. So my question was, if the aim is not to require surgery, would this be early diagnosis, better conservative management techniques, or a combination of the two? And Ramin said, I would definitely advocate for these approaches before surgery. Surgery is a last resort once the other variables have been optimized.
He was saying that, like, him and so the surgical panel where we had Dr. Beryl Tan, we had
Naveen
Samaya and Prof. Cheyenne. They were all saying that they are the last piece of the puzzle once everything has been tried and exhausted. And then it doesn't forego the need to continue to do those things after.
Yeah.
Because it doesn't get rid of the condition, the syndrome. The syndrome persists, but you have less of the tissue.
You've had a reset.
Yes. And in fact, they use that word, reset.
Yeah.
Prof. Shane used that word. Yes. I love that our surgeons aren't just wanting our money and wanting us to get on the table, that they're super discerning with our bodies. And it's a big thing to go through if you choose to go through surgery.
Yeah.
It's not a cure.
Yeah, I missed that one, but I remember at last year's, they had said that they get a team involved. Like they get dietitians and exercise physiologists and psychologists and counselors and like all of that. So they're looking after you as a whole person, not just get on my table, let's suck this stuff out.
Yeah, and
You had another key takeaway.
I did. So Lipoedema Australia did, so Jen and Megan from Lipoedema Australia, the board and the board chair and the vice chair,
Mhm.
did a talk, like a Q&A basically about what the future of Lipoedema Australia. And a really great question was asked about what we can do as people for the board. And I just thought, like, as a last, take home for this episode, I think it might be really important for us to talk about what we can do for Lipoedema Australia. The first of which, they're super open to any suggestions that we have for resources or things that could help us if they can create them under the Lipoedema Australia, branding.
Yep.
Then they are super happy to hear about any of our suggestions. And the other thing is really it's about funding. And it's not just like, if you have a couple of dollars to spare, that's wonderful, that sort of thing. But really, recurrent funding is really needed to drive the messages forward and to really get some traction in all of the initiatives that they're doing. So if you know anybody, that happen to be able to spare some money, consider giving to Lipoedema Australia. But if you know of philanthropic people with philanthropic ideas or endeavors, then connect Lipoedema Australia to those people that may have the means to help on a recurrent basis. I just think that the Lipoedema Australia board and the advisory board are all volunteers, and they did that entire conference in their own time, and they do everything for us in their own time. Shell, you do everything for us when you're with the board talking in your own time, and things will move slowly because you don't have infinite amount of hours to spend driving these initiatives because you all have jobs and families and
everyone has, like, we're all chronic illness,
That's such a good
so
point.
we have people tapping out quite often, and it could be for a month or two at a time.
Yeah.
So, it's really hard. And then our vice chair, Megan, got malaria when she went to Zimbabwe. And so, and that was just before the conference, like a couple of months. So, and she's like the driving force behind the conference. Like she was the one coordinating us all. And to have her out for, I think it was 5 or 6 weeks.
Wow.
It's tricky, but it's amazing bunch of women. I've been working on a little project behind the scenes, and I'm hoping that now the conference is finished that we'll launch it. But I have set up Lipoedema Australia in every state for Containers for Change. So when you take your containers back to get recycling, you can actually choose us as a charity.
Wow. So cool.
So yeah, that's been my little side quest.
Very good.
And we'll publish all of the codes that you can use. If it doesn't come up to select, you can use our code. And that'll be another way. Like I've done it twice now in the last month or so to trial it out. And I raised like $25.
Yeah.
Like, that's an hour's work of someone.
That's so good.
Yeah.
Every little bit helps.
It does. And and I thought, well, if we launch it for time for end of year celebrations and Christmas parties, and maybe people can take their container, and I've got some graphics, you can put it on the front of the box and people know that they're donating to Lipoedema Australia.
That's so
yeah.
Well done. What a great idea.
Thank you. Thank you.
Yeah, we've got the right people on the case, don't we?
Yes.
There was another thing that I was going to say. Oh, that's right. So if we want to make meaningful change and if we want that traction with like things like Medicare and stuff, first we need an Australian consensus of diagnosis. Putting that aside, the next thing we need is for our ministers to know that we care about this. And the only way that our ministers and local members know if we care about this is if we write to our ministers and local members. So Lipoedema Australia have all of those resources. I believe they have letter templates for ministers and local members.
You can get a pack sent to you.
There you go.
Yeah.
So grab those, use those, because the more our ministers and local members have to respond to our letters, come voting time, the more they think that they will get votes by creating initiatives to support us. So during voting time, they will start talking about our condition because we've raved on about it to them via our letters, and they've had to come back with responses multiple times. that before they get our votes, they're going to need to come up with some initiatives for us. So
Yeah.
that creates meaningful change, but it takes a lot. It takes all of us. If we can do that, I think we can get some traction. So just be aware of all those resources that Lipoedema Australia have.
Yeah. Do you know what? You just got me thinking we should invite the local members to our catch-ups.
Absolutely.
Oh, if
Ruth, you know-
anyone out there organises a catch-up in their area, maybe invite a local member.
Great idea.
Awesome.
So, and also the very last thing before we say goodbye, come to the next conference.
Yes.
I'm not sure when it is. We don't know when.
27. It'll be in 2 years'
27.
time.
And we don't know where it's going to be, but we'll be there. Very excited already.
We will be there.
Yeah, but come and it's just come and be part of something that's really magical. I just felt
Like the sisters you didn't know you needed.
100%. I just felt like I was meant to be there, honestly.
So cool.
It was it was incredible. So that's all.
Fabulous. Thank you for listening to us this afternoon.
Yeah.
And have a lovely day.
Bye.
Bye. The Lipoedema Podcast 2025 is powered by Elegance Lymphatic Care. Lipoedema and its symptoms vary from individual to individual. The opinions and advice voiced in this podcast are of a personal nature and used for educational purposes.
Please take away from this podcast what resonates with you, and please see your GP or preferred specialist for diagnosis and healthcare. We are Shelley and Tiana from the Lipoedema Podcast. Until our next episode, bye for now.